everybody, this is Howie, and this is a Module 2 discussion on article specifically for Shijani and Snell, Chapter 2 and 3, with particular attention to the family health genogram. I'm going to include the genogram into the post later. I made one. I have a small, very immediate family, and I haven't had any other splits in my family tree, so it's pretty simple. But I am going to say that if I'm going to be interviewing families, and I will be probably looking at the genogram, specifically if families have step families, because for example my best friend has a step family and it was broken twice, so she's going to have more, she's going to have more of a more complicated genogram than I would. But I've never worked in pediatrics, but I realize that nursing is going to be important for me, specifically even for psychiatric nursing. So, as an NP, and so regarding the Calgary model for genograms, it really reminds me of, I don't know, I'm trying to figure out why exactly they're really focusing on postmodernism and pluralism, because to me, I don't feel like that's very important. But I know that postmodernism is a philosophical movement that emphasizes multiplicity, but to me multiplicity reminds me of a time when I was taking a philosophy class and we talked about dualism, which is the belief that there is a separation of mind, body, and soul. Specifically that their soul is separate from the body, and so a lot of religions are based on that. But it really surprised me that I think it was Rene Descartes that discovered that, and he actually decided to think about it as some other way, that people have souls, and that's a huge basis of many religions, specifically Catholicism and Christianity, and even I'm assuming Islam, but I need to really research on that. So what I'm looking also at is that including more stuff about pluralism versus duality versus postmodernism, is that a book I was required to read for one of my cultural classes was called The Spirit Catches You When You Fall Down, a Hmong Child or American Doctors in the Collision of Two Cultures. So I think the research from Shijani and Snell shows that it's not only a little bit of influence about our belief when we're interviewing patients and their families, but it's also the fact that their beliefs can be much more encompassing and much more important than their medical beliefs. So we have to respect the fact that other people have really strong family ties that may or may not affect their belief. Which brings me to my other answer regarding how I would use a Calgary family assessment. Definitely I would probably focus more on the functional aspect, because I'm going to be working in psychiatry, so as a psychiatric nurse practitioner, family assessment, of course, is very important. Structural and developmental, both equally significant, but functional for me specifically because it has instrumental and expressive branches, and it has focuses on emotional communication, nonverbal and circular communication, problem-solving skills and roles. So these are the things that a lot of psychiatric patients are going to be focusing on in order to, and for me to be focusing on, to see whether or not they're having any progress in their mental health. So definitely, if I want to know if my patient, if they're depressed, do they have good coping skills? Do they have a good support system with their family? Are they supportive, or do they understand what depression is, for example, or schizophrenia or bipolar or things like that? So definitely we'll try to look more into the functional aspect of the Calgary assessment model. And my flight is boarding, so I'm going to go, but I hope this is enough of an answer. Thank you, and I will reply to all if anybody answers, and I appreciate it. Thank you.